All right. Hello, everyone. So this is Ryan Dickerson. I'm back to go over the vertebral column and muscles of the back. Once again, these resources are made by the Scrubs Resource Development Team, and Scrubs stands for Student Collaborative Resources for Understanding and Birdie Success. So once again, here's our mission statement. Just a reminder that Scrubs is a student-driven initiative that aims to develop supplemental resources for current and future cohorts that will pass through Birdie. If you are interested in joining this team at the conclusion of the course, we are always welcome to new members. All right, and then a disclaimer, again, Scrubs is providing supplemental resources, but these in no way are replacements for the instruction of the Birdie faculty. So use these resources as supplement, but not as your primary source for course material. All right. Now, as we move into this chapter, talking about the vertebral column and muscles of the back, I will do my best to follow as closely to the course back as I can, with as few deviations, but we may deviate a little bit along the way. So to start off with, let's talk about the vertebral column. So the vertebral column is the bony structure that is going to house the spinal cord. The vertebral column is made up of 33 vertebrae, that you have 7 cervical, 12 thoracic, 5 lumbar. So cervical is going to be up here near your neck, thoracic more in your thorax where your organs are located, your heart, your lungs. So that's going to be near your chest. Lumbar is closer to your pelvis. So your lumbar vertebrae, you have 5 of those. And sacral vertebrae are going to be fused. So it says coccygeal here, that should be sacral. But sacral vertebrae, that's your sacrum there, and we'll talk a little bit more about that. Those are fused vertebrae, and then at the bottom you have your coccyx, which can be a little bit variable in the number of vertebrae you have there. In between every vertebrae, you're going to see that there is an intervertebral disc, which I'm highlighting now. So we'll come back to this, but that intervertebral disc is going to be important because when you hear people slipping disc or rupturing a disc, that is going to be what that is being referred to. So going over some surface anatomy of the back, really what you need to know here is the level of the vertebrae that's being referenced by some surface landmarks. So for instance, the vertebral prominence is going to be at C7. This is going to be if you bend your neck, this is going to be the vertebral spine or the spinous process that you're going to be able to feel. And then the median furrow is right down the center of the back. The median furrow is formed, it's really the surface landmark that you can use to see where the spinous processes are located. So that's going to be right down the back. Some other landmarks that you're going to need to know is the spine of the scapula. If you see the spine of the scapula along the back, that is going to give you the rough location of the T1 or T2 vertebral bodies. Then lastly, you have the iliac crest, which this is actually, if you feel the bone along your hip, that's what you're feeling, that iliac crest. That's going to tell you that you're roughly at the level of the L3, L4 vertebral level. Now going over the general structure of the vertebrae, we're going to go over generalities before we go in between the different components of each vertebrae. But let's start with the vertebral body. So almost every vertebrae is going to have a vertebral body, and which is going to be the weight-bearing portion of the vertebrae, and then it's going to have a vertebral arch, which is in red here. So that vertebral arch is non-weight-bearing, but what its job to do is to protect the spinal cord, or your nervous system, which is going to sit right in this vertebral foramen, which is in the center of every single spinal cord, or vertebral segment. Other things we want to point out is the segments that make up the vertebral arch. Your vertebral arch, if you follow down here, is attached to the body via the pedicles, and then the spinous process, which comes out the front of every single vertebrae, is going to be attached to the pedicles via the lamina. So it goes body, lamina, usually you have a transverse process next, body, pedicle, transverse process, lamina, spinous process. Now the transverse processes are oriented towards the lateral directions, so transversely, so this would be the transverse plane, and then the spinous process goes straight posteriorly, and we'll talk about a little bit of differences between the different vertebral levels and how that spinous process may have 1 point or it may have 2 prongs. All right. And then lastly, what I want to point out here, we'll talk about this in a little bit greater detail in just a moment. In yellow here are your articular processes. It's going to say that you have 4 total. This is including one that is superior on either side and an inferior one on either side. So these articular processes allow, articulation is just the movement of joints across one another, so or bones across each other. So this is going to allow your vertebrae that is above to articulate, as well as allows you to articulate with the vertebrae that is below. All right, now going into a little bit more of the nuances between the differences between vertebrae, we're going to start with the cervical vertebrae. And what I'm highlighting here is just some of the unique features that are associated with every vertebrae. So let's start out with the transverse foramen here. The transverse foramen is common to all the vertebrae, but what I wanted to point out here is that this is a triangular transverse foramen. And this is going to be in the levels around C3 to C6. But the reason this is triangular is you're going to have a brachial plexus, which you will learn about pretty shortly, but that's going to be the plexus of nerves that supply your arm. And anytime that you have a limb, so your upper limbs or your lower limbs, you're going to have a region of the spinal cord that is going to turn triangular to widen up that space and allow more nerves to pass. So you'll see a similar thing in your lumbar vertebrae where your legs, the nerves that supply your legs, are located. Now, I'm not hitting right this moment the first two cervical vertebrae, C1 and C2. We'll hit those in just a moment. But as we continue looking at the rest of the cervical vertebrae, it's important to know that you have a bifoid spinous process. So that's going to be located right here. So that's one of the surefire ways to know that you're talking about a cervical vertebrae if it has that bifoid spinous process. Another great way is in the transverse process, you have a hole. And that's the transverse foramen. The transverse foramen is going to allow for an artery to pass through, which you'll learn later in the course. But the major thing here is if you see that transverse foramen and that bifoid spinous process, you know you're talking about a cervical vertebrae. Lastly, we won't talk about the articular processes. Each region, cervical, thoracic, and lumbar, are going to have the articular processes oriented in a very specific way. And this is going to allow for specific movements around in each one of these sections. So in the cervical region, these are located pretty flat. So they're horizontally oriented. So it's flat. So the one above and the one below sit right on top of each other. That's what that horizontal orientation means. What that's going to allow you to do is it's going to allow you to slide across these processes and shake your head no. So that's that horizontal rotation, shaking your head no. Right, and that's going to happen at the cervical vertebrae. In the thoracic vertebrae, you're going to have costal facets. So a special feature of the thoracic are the costal facets, and the costal just means per rib. So these are going to allow you to articulate with the ribs. So on each transverse process, as you see coming around, you're going to have a little facet. And that facet, again, allows for articulation with each one of the ribs. Right, and then the articular processes here, these are going to be oriented in the frontal plane. So you've got one that is going to be oriented primary posteriorly, and one that is oriented anteriorly, and they're going to articulate together in the frontal plane. Finally, the lumbar vertebrae, big things we need to know here. Again, these are big, stocky vertebrae. Your vertebrae get larger as they go down, which you can kind of see from the image. But again, because we have the lower limbs, the nerves that supply that segment are in the lumbar vertebrae, or in this region, you're going to have a triangular foramen, vertebral foramen, and it's going to be slightly enlarged. Okay, and then your articular processes here, they're going to be oriented in the sagittal plane. So that's going to mean one is oriented more medially, which is this one here, whereas one is more, the inferior one is oriented more laterally. And this is going to allow these to communicate with one another. This is going to allow for flexion and extension around the lumbar vertebrae. Now, some special vertebral segments we want to know, that's going to be C1 and C2. So C1 here is your atlas. So C1 is the atlas, and C2 is the axis. So the atlas, which holds up the world, or your head, is going to have a couple of key features. One is going to be these lateral masses. So these lateral masses have superior articular facets, which allow for articulation with the occipital condyles of the skull. You'll learn about the occipital condyles in a later component, but note that the lateral masses have superior articular facets which articulate with the occipital condyles of the skull. Other interesting things about the atlas is that you do not have a body, so no body anteriorly, and you do not have a spinous process in the back. You just have a posterior tubercle. Now, moving on to the axis, The axis has a superior directed odontoid process, which is known as the dens. Now, this is thought to be the remnant of the body from C1, but the important thing to note is that the dens is going to sit right here in this little groove of the atlas, and this is going to allow you to rotate your head in that no motion. Now, going on to the last little bit of the vertebral column, we're going to talk about the sacrum and the coccyx. Major things that you need to know about the sacrum and the coccyx is that the sacrum is formed of 5 fused vertebrae. The anterior surface is concave, so that's what we're seeing here, that anterior concave surface. And it has a medial region that is separated from the lateral region by these foramen. And foramen, if I haven't said so already, means hole. You're going to see this term pop up a lot throughout the course. So when you see the word foramen, think a hole or a structure, an opening that structures can pass through. Now, the anterior sacral foramen are going to allow the anterior rami of spinal nerves to come through. You'll talk a little bit more about what this means in a future section, but the anterior rami go through the anterior sacral foramen. The posterior rami, however, are going to go through the posterior sacral foramen, which are on the back of the sacrum. And then right here in the middle, these fused spinous processes are going to form your median crest. So median crest from the fused spinous processes along the back of the sacrum, and then at the very base of the sacrum, the spinous processes from L5 and sometimes L4 don't always fuse. That is going to allow an opening through the bottom of the sacrum, which is known as your sacral hiatus. And at the bottom of your sacrum, you're going to have the coccyx, which is can be a little bit variable in how many bones you have. It could be 3, or it could be 4, or it could be 5. But the big thing here is that it is the base of your spinal or your vertebral column. Now, moving on to the curvatures of the spine, this is where you're likely to get a clinical correlation question on a quiz or an exam. Knowing which one of these curvatures forms primarily in development, or does it form after birth? So that's going to be primary curvatures versus secondary curvatures. Primary curvatures form early and in the fetal period, and then sacral curvatures form at a later time. So primary curvatures are going to be the thorax and the sacral curvatures. Now, what I like to think about with both of these is they have the same curvature. They are concave in an anterior direction. Okay, concave in an anterior direction. So the primary curvatures, the thorax and the sacral curvatures, both have the same curve, which is concave in an anterior direction. So your cervical and lumbar curvatures are secondary curvatures. They form after birth. Okay, so these are going to have their concavity is the opposite of the primary curvatures. So you can see that you're really just making it flips between every segment. And if you keep in mind that the thoracic is the first primary curvature that is concave anteriorly, then it helps me to just flip these as I'm going through. Now, I want to take just a moment to talk about the exaggeration of these curvatures. If you have an exaggerated thoracic curvature, which would be, if you might call it hunchback. So this curvature, instead of looking like this, is curved way out here. That is going to be kyphosis. So kyphosis refers to an exaggerated thoracic curvature. Now, you can also have lordosis, which is going to be an exaggerated lumbar curvature. So this, instead of this curvature that we have here, imagine that the lumbar vertebrae come out, making a really big curvature. That's going to be lordosis. And finally, scoliosis isn't something that we can see in this plane. Instead of exaggerating a curvature anteriorly or posteriorly, what we're going to have is, imagine if I took a hammer and hit this vertebrae from the side, just like this, and forced it sideways. That is going to be scoliosis. And scoliosis is typically a complex lateral bending and torsion of the vertebral column. So not an image that is easily shown here. Okay, now talking about the intervertebral disc. The intervertebral discs are going to be located in between each vertebral body, and they are formed of the annulus fibrosus, which is fibrous tissue, and the nucleus pulposus, which is a more gelatinous tissue. Now, the nucleus pulposus is in the anterior side. So you see the annulus fibrosus has a little bit more cartilage up here in the front. So that means that if there is a rupture, it is possible for this nucleus pulposus to rupture backwards. Now, when the nucleus pulposus, this gelatinous tissue, pushes through this ring, the annulus fibrosus, that is what we call a herniated disc. Okay, and we can see that the function of these intervertebral discs is to allow for compression of your spinal cord when you're flexing, extending, or you're carrying heavy weights. But if this nucleus pulposus is to rupture through, that is going to be a herniated disc. And herniated disc may press on nerve roots or the spinal cord, which is going to be located here in the vertebral column. And then they can then cause pain or loss of motor function to the regions that they supply. Now, going through the ligaments of the spinal cord, the anterior ligament of the spinal cord is going to be on the anterior portion of the vertebral column. This ligament spans all the way from the top of the vertebral column to the bottom of the vertebral column, and its main function is to limit hyperextension. So the anterior longitudinal ligament limits hyperextension. Now, the posterior longitudinal ligament is going to be on the posterior portion of the vertebral column, and this is going to limit hyperflexion. So hyperflexion, or think taking your chin and putting it to your toes. Hyperflexion of the spinal cord. Now, the ligamentum flavum is going to be this ligament here. It joins the lamellae from in between the spinal cords, but we can't really see those here, and it's shown as white, but in the cadavers, you're going to see this as a yellowish color, and that's because it contains yellow elastic tissue. Now, right here, again, this is a cross-section of the spinal cord. This is going to be your spinous process, which is oriented posteriorly. In between each spinous process, you have an interspinous ligament. So this is a ligament that goes in between the spinous processes. And then if I was to go on top of every spinous process to look at a ligament, that would be your supraspinous process. This supraspinous process is going to be thickened in the cervical region, and it's going to be called the ligamentum nuchae, which we'll see in just a second. So speaking of the nuchal ligament, or ligamentum nuchae, here it is. Over top of the spinous processes, you have this thickened ligament that comes up in the spinal region, and that's your nuchal ligament. The one other ligament that I want to point out is in between, so this is going to be C1, and there is the dens for C2. There is a transverse ligament, and this is the transverse ligament of the atlas, and this is going to hold the dens of C2 against the anterior arch of C1. Now, if this ruptures, this can be a very serious issue, so this is a very good ligament to keep in mind, as you will likely get a question on this ligament rupturing at some point during the course. Okay, so now we're going to transition into talking about the muscles of the back. The muscles of the back are arranged into three different groups: a superficial, intermediate, and deep group. The superficial and intermediate groups are the extrinsic back muscles, and the deep group is an intrinsic layer of back muscles. Now, the big point that I want to make here is the superficial and intermediate group are innervated by anterior rami of spinal nerves. So superficial and intermediate groups innervated by anterior rami of spinal nerves, and we'll come back to this at a later date. So now going into the actual muscles of the superficial group, the first layer of superficial muscles consists of two muscles. That is going to be the latissimus dorsi, which is located here, it's this muscle, and the trapezius. And you don't need to worry about the different components of the trapezius, just recognize this is all the trapezius right here. That forms the most superficial layer of the back. If I were to take these muscles away, as you'll do in lab, you're going to see that there are a couple of muscles still within the superficial group that are deep. That's going to be your rhomboid major, rhomboid minor, and the levator scapulae. And you'll cover these a little bit more in lab. We'll cover these again at a later time as well. But the big thing here is rhomboid major is inferior to rhomboid minor, and then you have the levator scapulae, which is the most superior of these muscles. Going into the intermediate group, These muscles have a function in the mechanics of respiration. The two muscles in this group are the serratus posterior, superior, so serratus posterior, and it is superior, so up above, and serratus posterior, inferior. These muscles are innervated segmentally by anterior rami and are vascularized segmentally as well. Now, getting into the deep group, these are the intrinsic muscles of the back, which means that they are all innervated by posterior rami, which I have up here in red. Now, the deep muscle group has two different layers, so we're going to start with the most superficial layer. Now, these muscles in general, acting bilaterally, extend the vertebral column and regulate flexion of vertebral joints, and when they contract unilaterally on one side, you can have lateral bending and rotation. So the most superior of these muscles is the splenius, and the splenius is broken down into the splenius capitis, closer to the skull, like where I wear my baseball cap, and the splenius cervicus, which is more in the cervical region of the spinal cords. Right. Now, the muscle is wrapped around the other deep muscles of the neck, and it originates from the ligamentum nuchae and T1 through T6 spines and inserts into the transverse processes of C1 through C4 and superior nuchal line in the mastoid process for those two different segments of the splenius cervicus and splenius capitis. Now, we also have the erector spinae muscles. This muscle is responsible for the gross movement of the spine and extends from the pelvis all the way up to the skull, right? And that muscle is located here. It's this entire muscle. And this muscle is actually broken down into three different segments. The three different segments are iliocostalis, most laterally. I go more medially, I hit the longissimus, and I go most medially, and I've got the spinalis. So this is your erector spinae group, and the mnemonic that we use to make sure we know from lateral to medial is I love sports. So iliocostalis, longissimus, spinalis. Now, lastly in this group, we have the transverse spinalis group, which we'll see on the next slide. So continue with the deep muscle group, we have the transversospinalis group, and this is an oblique group of muscles that is deep to the erector spinae, and its fibers pass superior medially from the transverse processes of the spine. So they're coming from inferior laterally, going up superior medially to those spinous processes. So from down below to up above, right? And the function of these muscles is primarily involved in stabilization of the spine and occupies a space between the transverse and spinous processes. The semispinalis is the most superficial member of this group. So there goes the semispinalis capitis. Semispinalis cervicus is the most superior as well. And these fibers are going to span roughly 5 segments. So 5 vertebral segments, so they're really long. Then you go to the multifidus, and it has different regions from the lumbar region to the thorax. And these fibers are going to span about 3 segments as opposed to 5. And finally, you have the rotores, which are deep to the multifidus, and they span 1 segment. And they are most developed in your thoracic region. So it goes 5 segments with the semispinalis, 3 segments, multifidus, 1 segment with the rotators. And then you also have some deeper muscles, which are going to be your intertransversari. These are going between the transverse processes of the spine or vertebral column. The levator costorums, this is going to elevate your ribs. And then a muscle that you can't see here, in between the spinous processes, you'll have the interspinalis muscles. Now, these muscles are small and accessory. Really just include them here for completeness sake. Now, going into some clinical anatomy, this is going to be a section that is going to be at the end of all of these little videos, and it is probably the most high yield and most important section to know. So we're going to start talking about the intervertebral disc. So the intervertebral disc are tough structures in the young, and injuries to the vertebral column can produce fractures of the vertebral bodies rather than the disc injuries themselves if you're a younger patient. But as you get older, the discs become more fragile, and compression injuries may cause rupture. So compression, you see that we get flattening of the nucleus pulposus, and it can cause rupture of the nucleus pulposus through the annulus fibrosus, which is this outer ring here. So this results in a herniated disc, which may produce pressure on the nerve roots. So the nerve roots back here in the vertebral column. And then this can cause pain or motor symptoms in the regions that those nerves supply. Now, back pain as well is one of the cost of humans' upright posture. Jesus. 3 factors make back pain so common, particularly in the lumbar region. And this is the loss of water content and elasticity from the nucleus pulposus, right? Because again, we talked about the nucleus pulposus. This gelatinous tissue is pretty full of water. So this makes it more prone to injury, particularly after the age of 30. Then poor posture over long periods may stretch and weaken the ligaments posterior to the vertebral bodies. So the ligaments back here. And then sitting slumped with the lumbar spine flexed instead of the normal position of lordosis is particularly bad. And then lastly, lifting weights with the lumbar spine flexed imposes great stress on the lumbar disc, tending to force them posteriorly or posterior laterally. Now, what I want to point out is when we are lifting weights with our lumbar spine flexed, that is going to be pushing our spine backwards. What is the ligament that is keeping the spine in place from hyperflexion? So think back to an earlier point and answer that question. Now, the last clinical anatomy correlation that I want to put in here is rupture of the transverse ligament of the atlas. So the transverse ligament here is keeping the dens in place on the atlas. But if this ligament was to be ruptured, meaning it was to be torn, the dens could be fractured and forced posteriorly, which would be in this region, which is the same region that your spinal cord runs through. So if this happens, you can have complete transection or severing of your spinal cord in this region. This is of particular concern with victims that have had suspected neck injuries, such as a whiplash from a car accident. So this is why you have to be extremely careful in supporting the head until clinical and radiological evaluation can be carried out to make sure that this transverse ligament has not been torn.